On September 12, 2025, Ohio's government actions encompassed major legislative, executive, enforcement, and public event activities as follows. 1. Legislative activities. The Ohio State Senate passed Senate Bill 1, SB 1, known as the Advance Ohio Higher Education Act. The Ohio House of Representatives also made amendments to this bill around this time. This legislation aims to address higher education policies in the state. The FY 26-27 state budget reflected more state tax revenue than anticipated, $52.1 million above estimates in August, due primarily to strong commercial activity tax, CAT revenues, despite a drop in auto sales tax revenue. Total tax revenues for August reached $2.57 billion, exceeding estimates by 2.1%. 1. House Bill 96, HB 96, the operating budget, included a change, renaming the Ohio Department of Mental Health and Addiction Services, Ohio MHAS, to the Ohio Department of Behavioral Health, DBH. This bill also adopted a new framework providing greater flexibility to local boards overseeing mental health, addiction, and gambling prevention, treatment, and recovery supports. 2. Executive actions. Governor Mike DeWine and Ohio Department of Health Director Dr. Bruce Vanderhoff announced the launch of Ohio SEE, a new children's eyesight program developed by the Governor's Children's Vision Strike Force to improve vision care access for Ohio students. Addressing that only 26% of those needing extra vision care currently receive it. 1. Governor DeWine activated the State Disaster Relief Program, SDRP, to support 12 counties affected by emergencies or disasters, providing aid and resources at the state level. 3. Enforcement and regulatory actions. Governor DeWine had earlier directed the Ohio State Pharmacy Board to classify kratom as an illegal substance, but paused the enforcement action pending legislative decisions. On September 12, a public hearing was held for proposed regulatory rules by a state agency, as announced by the Ohio Attorneys Consumer Council, ACC, allowing public input on regulatory changes. 4. Public awareness and events. September 12, 2025, was also nationally observed as 988 Day, a day promoting awareness of the 988 Suicide and Crisis Lifeline. The Ohio Department of Behavioral Health highlighted this vital resource, providing free, confidential mental health and substance use crisis support 24/7. Additional contextual information from the period includes discussions around education funding policies and executive orders affecting state educational institutions relative to federal education policies. 2. And state health policy developments, particularly vaccine and drug application regulatory stances, were noted by the Health Policy Institute of Ohio. 5. In summary, September 12, 2025, was marked by significant legislative budgetary adaptations, key health and social service program launches, executive disaster relief activation, regulatory hearings, and mental health awareness initiatives, reflecting a wide range of Ohio government activities involving multiple agencies and officials, including Governor DeWine and department directors. 1, 2, 3, 4, 6, 7.